reference center for mental health and psychosocial support.
Thank you, Gana. And now, to start, we are gonna have the pleasure to invite to our manager of the Health and Care Unit, Panu Saristo, that is having a special message for all of you to open this forum. Over to you, Panu.
Thank you, Gracie. Is my audio okay?
Clear and loud.
Excellent. Welcome to everybody. I'm Panu Saristo. I'm the manager of the regional health team of the International Federation of Red Cross and Red Crescent Societies, based in Budapest, Hungary. We are overseeing the health programming, including mental health and psychosocial support in 53 national Red Cross and Red Crescent societies in the Europe region, including Central Asia. I'm particularly pleased to invite everybody into this webinar. The Global Day for Suicide Prevention was a week ago. Clearly, this is a topic that needs to be discussed on every day of the year and not just commemorated or celebrated, or how do you want to call it, during one dedicated day in the year. And therefore, the topic or the title of this webinar and the future global days is that we need to start and keep the discussion alive. We need to talk about suicide, and we need to change the discourse, and we need to change the narrative. It's hugely important. Suicide is a public health problem. It is not only about the person who loses their life in a completed suicide. It's also the consequences to people near and far in the vicinity of the person in many ways that we don't even think about in the beginning. Or immediately when we think about suicide. The legal frameworks can make this something that is illegal, which sounds like a difficult concept to explain. However, it can be consequences for the family that is left behind. Understandably, the stress, the pain, the suffering of everybody close to the person who commits suicide, and also the suicide attempts that can leave the person horribly disfigured, incapacitated, and damaged psychologically and physically for life after a suicide attempt. This is very close to the heart of the Red Crosses, especially in my region in Europe. We have a regional resolution to bring mental health and psychosocial support to the forefront of what we are doing. And that is kind of the instructions that the membership gives to us, the IFRC. Suicide prevention is clearly a central piece of our work for improved mental health and provision of psychosocial support. So this is part of our task list vis-a-vis our membership. And I'm very happy that you all chose to share this moment with us. You will hear wonderful experts. You will have a very intriguing panel to listen to. And I thank you and wish you welcome. Thank you.
Thank you so much, Panu, for your words and open this event. You say key words around your speech that one could be that this is a health issue, public health issue that we have and everyone needs to get in. So to continue with the forum structure, we are gonna go now for the panelist round. And as Panu mentioned, we have 4 panelists that are experts, and we hope that you can be in contact with them as well. And you can leave questions in the chat box, and Gulsira is going to be following that, okay? I'm going to start, and I have the pleasure to call Professor Rory O'Connor, that he is the president of the International Association Suicide Prevention. Professor Rory, please.
Hello, welcome, good morning, good afternoon.
Yeah, you know, this is for me a real dream to have you here in this forum, because it's also, we are demonstrating how we are joining efforts, because everyone needs to be engaged in this topic.
Mm-hmm.
We want to begin with you, this forum, with a question that maybe many of the people that is here are interested to know more. Could you please let us to know why the association select this specific topic for 24 to 26 that is changing the narrative on suicide, please?
Yeah, no, it's a great question. So every 3 years, the International Association for Suicide Prevention establishes a theme around World Suicide Prevention Day. And so the previous theme for the previous 3 years was working together to prevent suicide. But for this 3 years, we always engage in a consultation with our members internationally to try and see what the theme will be. And I suppose one of our messages we wanted to convey for these 3 years were that we all can do something to prevent suicide. And crucially, we wanted to build on the amazing work which is going on internationally, trying to tackle the stigma around suicide. Because sadly, in 40 countries in the world, suicide is still criminalized. And in many other countries, it is still frowned upon. And so what we were trying to do was help people think about changing the narrative on suicide, away from a message of despair to a message of hope. Because as has been mentioned already, suicide is a public health concern. It's more than a mental health concern. And indeed, if we look at the rates of suicide across the world, at least 700,000 people die by suicide each year. And the majority of those deaths are in low and middle income countries. And many of those deaths are also in areas where there's been a history of trauma, conflict, and displacement. And indeed, we know that people who are displaced experience trauma, asylum seekers, whatever the context is, their risk of poor mental health is increased. And sadly, their risk of suicide is increased. So what we're hoping and what this webinar is contributing to is our first sort of mini theme for this year within the context of changing the narrative on suicide is, let's start the conversation. Let's talk about suicide. It's okay to talk about suicide. If we talk about suicide, we challenge stigma. Challenging stigma breaks down barriers to help seeking. Breaking down barriers to help seeking saves lives.
Totally agree with you and your strong message that we need to break the silence and fight stigma, because stigma we saw, and we are convinced as well as a Red Cross, Red Crescent, that there is a place for us to advocate and change this narrative. Professor, we know also that recently this year happened an amazing event that was the European Symposium on Suicide and Suicide Behavior in Rome. We are really interested to hear from you if you have any successful or impactful strategies internationally that be really effective to address suicide prevention and, you know, open and change the narrative and open the conversation. Over to you.
Well, at the European Symposium, it was a 5-day event, 700 delegates. So, and there was hundreds of talks, and there was lots of really encouraging research being published, because one of the challenges we've had over the sort of history of suicide prevention is we've been too often working in silos. The psychologists would work together, the psychiatrists would work together, but separately, and the social policy people. And what we've started to do as a field, and one of the key messages that came from the conference is that genuinely it's only through working together that we will tackle the scourge of suicide. And I suppose one of the messages was that for us to tackle suicide, we have to tackle the structural drivers of suicide. And so actually, I talked about in my presentation, I talked about a piece of work that we published last year, and it was led by a mental health charity in the UK called MQ Research. And what we did is we brought together world experts from across 40 countries, 40 experts across the globe, across 5 continents, including researchers, people with lived and living experience of suicide, policymakers, clinicians, everybody who's got a stake. And one of our key messages when we were looking at the challenge and the sort of stigma around suicide and how we move forward was, we identified the key drivers to suicide and key solutions. And that paper was called the Gone Too Soon Project, and it's freely available on Lancet Psychiatry's website where we published it. But again, the key message was these structural inequalities, racism, discrimination, gender inequalities, war, conflict, these are the structural issues we need to advocate to change. So although suicide, of course, each death is an individual tragedy, but it leaves behind this wave of devastation, devastated communities, devastated families, workers. And so it's been estimated that for every person who dies by suicide, there's potentially up to 135 people affected who knew that person. So if you think, then the ripples are vast. And so one of the key messages that came out of the conference were there are simple things as well as complex things that we can do. So for example, one of the simple things that we all can think about doing is that if somebody is in a suicidal crisis or if somebody is in distress, everybody should have what we describe as a safety plan. And that safety plan is like an emergency response plan. And that emergency response plan is relatively straightforward. It's got 6 steps. And this sort of 6 steps are around working collaboratively and compassionately with the person who's struggling to help them identify the warning signs that a suicidal crisis might be escalating. And then the steps 2, 3, 4, and 5 of this safety plan are about identifying people, places, and activities that you can engage in or go to or contact, either to distract yourself from that crisis or where you can go to in an emergency if you are concerned you can't keep yourself safe. And then the last step, and then I'll hand back to you, step 6 is working collaboratively with the person to keep their environment safe. In other words, to increase the distance between them and perhaps the method of suicide they've thought of. And I suppose my message is that we all can work together on safety plans. And if you want to know more about safety planning, we've got lots of details about safety planning on our website, on my research website, which is separate from the International Association for Suicide Prevention. But if you go to suicideresearch.info, so suicideresearch.info, we've got details on how you do a safety plan and guidance and tools.
Excellent. This is wonderful what you say, that is joint efforts, that this is the principal strategy as I can see here, plus these safety plans that we are for sure really interesting as a national society because it's under our kind of a structure, suitable resource that we can know more. And for sure, we are going to visit your website. Unfortunately, time is now here. We are going to back to you in short time for another space that we have with all of you. And I'm going to pass the floor to Ghana to continue now with more regional, because we explore more global, and now we are going more for regional. Over to you, Ghana.
Thank you, Gracie, and thank you, Professor Gorner, sharing this strong messages with us in the spirit of cooperation and working together, but also zooming into the region. I would like to introduce Dr. Lydia Lazari, and she is a regional advisor for mental health in WHO Regional Office for Europe, working closely with the governments and the countries to address, to revise, develop mental health policies on the country levels. I would like to pass the floor to you, Lydia, with the question how these global numbers that Professor Corner shared are reflected in the region, and how do you see suicide prevention is addressed on the country levels and included in the country level policies? Over to you. We see.
Yeah, we see Dr. Lydia is there, but maybe she's facing any kind of connection problem.
Do you hear me?
Oh, now we do.
Oh, okay. I apologize. I apologize. Thank you so much. I was saying thank you for inviting me to represent WHO, but also thank you for allowing me to take this call from a noisy environment. I'm here in Athens at the closing conference of the EU Joint Action Implemental on Mental Health, and where suicide prevention is one of the two pillars on which 21 countries of European region have worked upon. So I will start by echoing my esteemed colleague that took the floor before, confirming that also in Europe we have seen a decrease of numbers of suicides, which is of course good news, but it's not good enough, because every life lost to suicide is a loss too many, is a death too many. So we cannot stay complacent, celebrate the fact that suicide numbers have decreased, because there is still so much to do to make possible that there is no life lost to suicide. I would like to present you with a bit of a contradictory situation that we face, not only in the WHO European region, but elsewhere. Because while we see a drop of suicide rate worldwide, including Europe, we see also a drop of mental health professionals numbers. For instance, as per the World Mental Health Atlas, the WHO European region lost about 13%, 13% of its psychiatric nurses workforce, which is a very significant number. At the same time, we see that the treatment gap in the WHO European region is still high. For instance, 1 in 4 people living with a psychotic disorder are not receiving any treatment, any care, any contact with mental health services. So the contradiction here is that while we see that the numbers of suicides are dropping, we still see with alarm that treatment gap remains and that mental health professional numbers are shrinking, which means that it is clear to address suicide and to improve and to strengthen suicide prevention, we would need to go beyond the mental health responses. We need mental health services responses. We need to ally, to partner with communities, with stakeholders, with groups of interest, so that there is maximal commitment from so many partners in order to support and to stand by persons at risk and to secure the support that Rory was suggesting before. In doing so, WHO is proposing, has published its resource for suicide prevention that is called Live Life. I will share the link to that in the chat for all the participants. And the Live Life is proposing strategies that are based on evidence to be effective. The first strategy is reducing access to means of suicide. And there have been policies, including in the WHO European region, such as, for instance, control of pesticides market, that have proven to have significantly contributed to the drop of completed suicides around the world. So this is means of suicide. We can discuss what other means of suicide, but they are easily accessible in both WHO website and other resources for suicide prevention. Another aspect is very much related to communication, and I hope it contributes to the discussion of this meeting, That is, how can we change the narrative through partnering with media professionals into not only shaping how we communicate about suicide based on the evidence that each public communication about suicide has the potential to escalate suicides among vulnerable or persons at risk, but also how can we provide, so it's not only about doing damage control, but it's also about contributing to a positive narrative. So exactly what Rory was saying, changing the narrative. There is evidence that this is possible. WHO has, again, resources about that. We have published resources for media professionals, for filmmakers, about how to portray suicide or persons who survive suicides or who are in bereavement because of suicide. So how to talk about that, how to talk to these particular groups at risk. Another strategy is strengthening social-emotional skills among the young persons. And this is truer than ever now, when we see that our young people, having survived a COVID-19 pandemic, having come out as a group at risk, as a vulnerable group after the COVID-19 pandemic, experiencing an increase in suicide and anxiety disorder, significant increases. So we can understand why working on improving emotional skills in children, adolescents, young people, and their parents is important. And last but not least, and this is more part of the specialized services, is early identification and support. So those are very briefly the strategies that the Live Life tool of WHO suggests, and I'm happy to take any question if those are around. Again, thank you very much for inviting me.
Thank you so much, Lydia, giving that space and time. We had a second question of the advice and your view on the actionable steps, but it was fully comprehensively covered in the second part of you presenting it. And thank you for finding the time to join us, being busy at the event. I think it's very important to hear that the commitment on the higher level is there, the awareness and the conversation are taking place, and everything is being aligned in terms of contributing to safe environments and access to the restricting access to the means, on taking actionable steps and using the media for the change of the narrative, bridging the treatment gap and working on health professionals, by increasing access to services to people in need. And thank you also for mentioning youth as a critical group that requires more attention and connection with, and I think our next panelist will continue that theme, and over to you, Gracie, for introducing. The microphone, Gracie.
Sorry, I'm gonna take the words of Dr. Lazari related to the necessity for social skills among the youth, because this is a concern that we have. As we know, suicide is the third leading cause of death among youth between 15 and 19 years old, and is the second cause in our European region. For that reason, as it's really important, this co-creative and participative approach for us, youth need to be on the table and join efforts and have a voice here. We have today the pleasure, and I call Lucia Chocarro Martinez. She's from Spanish Red Cross, but as well, she's part of IASP European Youth Coordinating Committee representative. Lucia.
Thank you, Gracie, for having us here. Yeah, so I'm coming from the Spanish Red Cross, but I'm here today as chair of the Coordination Committee for Europe and Central Asia region. So really happy that Dr. Lazari, in fact, started the conversation talking about youth in that sense. I don't know, Grace, if you want me to go directly into the topic, or if you want
Yeah,
to
we
shoot
can
some
go
questions
directly to the
first.
topic because we are really interested to know more from your perspective, especially related with some negative factors that are around, that are unemployment and bullying. And over to you to speak more about this and make a call to everyone that is here and understand better from your perspective and what we need to do as adults and change our minds as well. Over to you, Lucia.
Thank you. So it's true that what Dr. Lazari was saying, regional-wise and Red Cross-wise, the mental health on the youth side of the table to some extent started 2 years ago after COVID. We saw an increase in every national society of a reality that our young volunteers, young beneficiaries, children that we work with were facing mental health issues in different perspectives from different backgrounds in different situations, but we saw an increase that it was so obvious that it was not impossible to not follow up. That led to what we call now the Youth Mental Health Manifesto globally, not only in the Europe region, but in the I4C globally, where every youth leader, every national society joined forces on the youth side to call an action for senior leadership to include us first on the table. So here today, in that sense, it's a tick, but also investing more in our own resources to target what is a clear reality in our work every day. So if we go back to what it's bullying and unemployment specifically, what we have seen in the region the last year, we saw prioritizing from the youth leaders on the topic. We saw that every national society is doing something to some extent to try and targeting the issue. We are seeing that, first of all, because what the Mental Health Youth Manifesto was asking for, every national society in its different capacities in different ways, it's focusing on breaking the stigma. This is the first thing that we identified that was the most important, that it was opening the conversation. That is the first thing that we are also talking today. We are doing, the Netherlands Red Cross is, for example, doing podcasts on the topic with youth volunteers talking to young peers. The Swedish Red Cross has a hotline. The Spanish Red Cross is doing raise awareness on social media. So we are seeing the same approach, different national societies, different ways. It's true that if we go back to bullying and unemployment, it's two different ways that we see national societies and what we see youth facing the situation. Bullying is a topic that national societies have been covering for the last years. It's not new. We were already working on it, really specifically raising awareness, working as Dr. Lazari was saying, with families, with the volunteers that are also working with the children to be able to, as we say, look, listen, and link, to be able to follow the steps perfectly when that happens. Unemployment, it's something that has also been triggered a bit more after COVID-19. And something that we are seeing in general is not only that young people are suffering pressure from society in general about unemployment specifically, but about achieving certain milestones at certain times. We are seeing an increased anxiety. We are seeing that if you are not in the right moment, if you have not done education, if you have not finished education, if you're not getting a job at the right time, you're failing, you're not doing something correctly. And that leads us, Dr. Lazari was saying, to anxiety, depression, and then at the end of the day, we see mental health issues raising. This is something that we are seeing in our own volunteers, that we are seeing also in the beneficiaries of our projects. And this is a conversation that we need to have in the open so that we are able to target both internally and externally.
That it's inspiring to see how the youth are engaged with mental health and it's in their agenda, and you are doing many actions to open the conversation, change the narrative, transform our society, and also to make more visible how important it is to have the perspective of youth. Because my next question is going more in an advice from your perspective in how, as I say, adults, we need to adapt to your real needs and speak your language, because this is the way also to facilitate, to open the discussions, and people can feel more open to speak about the challenge that they have related to unemployment, to bullying, and as adults, we need to know the new ways to really effectively address that. Over to you for that advice.
Yeah, so we would advise the same that we advise for peer-to-peer support. We always advise open communication. We advise no judgment. We advise, specifically if we were talking about mostly social media and what is social media communication, but also WhatsApp, internal communication, we advise two specific things. Jokes around oh, I wish I was dead, that is a bit common. It's a sign that something is going wrong and we do not have to put it away. And we also take really carefully the beginning and the ends of conversation. What is the answer when someone asks, how are you doing? But also, what is the question of like, do you want to see each other? See you next. What is the end that the person that may be suffering something is giving to you? Because there is the sign there specifically that we are seeing in young people. It's also the sense of memes, different kind of social media, emojis and kinds of things that are at the end showing that something is going wrong. So that's the reason why we go back to the look, because it's true that right now also with what is social media and other kinds of communication, it may not be as obvious. It may become as a joke. It may become as something that is just funny and is just funny communication, but it's not. And we need to be really careful and be asking the serious conversation of like, are you really doing okay? Or do you need to have a conversation after this? So this is something that we are pushing in general. As an example, you can go, Spanish Red Cross had just, due to the prevention suicide campaign day a week ago on the youth section, we did several videos on the topic on how to have that conversation from peer-to-peer support, but also in the sense of like how to have it, it's not completely related, but also transversally from the adult perspective to a young person telling you that they're doing drugs, for example, how to have that conversation openly, making sure that the person's not feeling judged and they're open to tell you what they're thinking. And then the last thing would be to be able to link back once that has finished. So not kind of like leaving the conversation hanging, but going back to that conversation and putting steps to follow up to that, so that it doesn't feel like I've listened to you once, but I'm not listening to you again. I'm listening to you now, and I want to follow up on this of how we can do better.
I love it the way that you present this advice using the psychological first aid. Look, listen, and link. This is marvelous because it's something that all of us, we are really familiar, but we need to see how flexible, amazing is to use the principle of PFA also in address suicide prevention and start a conversation. Will be really nice as well, Lucia, to have access to these videos that you mentioned for everyone that is here. Be aware of that and learn more how to start the conversation with the youth, okay? Thank you, Lucia. We are gonna move now to Ghana for our last but not least panel.
Thank you, Lucia, and thank you for passing the floor. And there are a lot of resources shared in the chat. Please also take a look there. And thank you for Lydia and Rory for doing that. And the questions in the chat already, and we understand that there is a high level of awareness, a high level of dedication, but what it comes, to very down-to-earth situation when we are faced with it, how we feel able to do that, and there are questions around that as well. And in that, for that, I would like to introduce to you Beth Hawthorne, and Beth is a psychosocial practitioner in British Red Cross, and we would like to hear from Beth, who is actively involved in the work of around suicide prevention and integrating that in the psychosocial activities of British Red Cross. Beth, can you tell us some examples of initiatives, activities, programs in British Red Cross on suicide prevention and integrating them in the psychosocial support programs? Over to you, Beth.
Yeah, of course. Thank you so much. And it's so lovely to be here and see so many people that have joined this call. So thank you for that great question. So I'm a psychosocial practitioner and part of the psychosocial and mental health team in the British Red Cross, as Ghana just shared. And in the British Red Cross, our mental health initiatives range from generic resources that are available to everyone. So this would include things like an employee assistance phone line, mental health guidance documents, and video resources. And I think the link to some of these resources will be posted in the chat. So of particular relevance today is the Having Safer Conversations About Suicide video. So I'd encourage you to give that a watch when you have a chance. I saw a comment pop up about, what do we say, in these really tricky conversations? So that video is brilliant to give some tips of how to even begin. And then they range to more specialist services that not everyone in the organisation will find they need the use of. So I'll just talk through a selection of some of these initiatives that we have in the British Red Cross. So my team, the psychosocial and mental health team, offers reflective practice groups. So these are usually monthly sessions for teams to have practitioner facilitated discussions around specific mental health and psychosocial concerns. And the focus of these groups is on the people using our service and how to best support them. So staff and volunteers can use these groups to confidentially discuss service users that they're supporting who might be experiencing complex mental health challenges or suicidality. And we found these groups to be really helpful in building workers' confidence in managing these concerns, but of course also to help them reflect on the inevitable personal impact of this type of work, which we all know can be really significant. We also offer what we call joint consultations. So this is when a member of my team, a qualified psychosocial practitioner, will join a member of staff or volunteer to meet with a service user that they're concerned about. And then the practitioner can provide support and advice to the staff member and the person using the service. So a personal example, I've recently supported a staff member in an appointment with an unaccompanied asylum-seeking young man who was having thoughts of harming himself and hadn't shared this with anyone else before. So together with this young man, we were able to co-create a really simple safety plan that included his coping mechanisms and a safe place and safe people he could contact. So that's kind of drawing back on what Rory mentioned before about the power of a really simple safety plan that you co-create with the person you're supporting, or you can, develop your own for yourself. We also offer a menu of workshops which provide opportunities for staff and volunteers to develop further competence in the area of mental health. So we're currently rolling out the delivery of a workshop titled An Awareness of Suicide and Self-Harm, because we're so aware of the need for increased confidence around managing this. And one practical tool participants can take away from this workshop is an awareness of what a safety plan is and how they can be used to support individuals in crisis. I don't have time to go into this now, and Rory helpfully did, but I've shared the slides on just the section of this workshop that's on safety planning, because that's a real practical tool. So please do have a look at those slides. They're a way that we can just support conversations around suicide prevention that we can all really easily familiarise ourselves with. And a final initiative I wanted to mention is our brilliant team of peer supporters. So these are members of British Red Cross who have volunteered their time to undertake additional training and development to provide wellbeing support to the teams that they're in. So the peer supporters know their teams better than we ever could in the psychosocial and mental health team. So they are key in helping build team resilience and just normalising those really important conversations about mental health throughout the organisation. So that's just kind of a little snippet of some of the initiatives that I feel particularly excited about in the Red Cross.
Thank you so much for sharing. And I think we moved into the area of supporting those who are working with suicide on the ground. And thank you for mentioning reflection spaces, which are supportive supervision areas and venues, and how important it is to not only train people on how to, but also to do a comprehensive support afterwards, because it's always a dynamic process of learning and building the confidence to do better and to do more efficient. So thank you so much for sharing that. And I have another question. From all of the work that you are doing, how do you see it's being reflected on the community level in general? How do you know that it's working? Is it this knowledge and support that you're disseminating? Are they getting out there? Because as we're seeing, it's no longer an excuse of not knowing, because the resources are there. It's more on how to. But how do you see the impact on the community level and the community members leveraging the resources that you are providing?
Yeah, it's a really good question. And I suppose my key message in terms of leveraging community resources to have these meaningful conversations is to familiarise yourself with what is out there. So your local mental health referral pathways. In Red Cross, we use a basic template where teams can input details of local support pathways that range from emergency response to longer term community follow-up, but it's specifically tailored to their geographical area. We're across the whole of the UK, and there's a vast variety of resources available that often we don't know. But also we would try and include more generic national 24-hour phone lines, such as Samaritans, that can be accessed at any time. So the teams would then have a simple document to use when they need to make a decision about where and how to refer for further support. So, for example, in Manchester, where I live, an organisation we'd regularly include in this template is called Yaron, and they're a charity who offer therapy and advocacy in a culturally sensitive way in a number of different languages. And I think many of us might not be aware of the resources on our doorstep. And so having an idea about what these are and how to access them can give us confidence going into those tricky conversations, knowing that we can signpost for the support if this is wanted. I'd also say that if you have influence in designing services, I think encouraging participation of those with lived experience in the development of any initiatives is key. For example, in British Red Cross, we have the incredible Voices Network that we're so proud of. This is a collective of refugees and people seeking asylum who advocate on key issues. They share unique and incredible valuable insight into the communities they're from. So it's really important to use their voices when thinking about community resources. And then finally, I'd just like to share that we're also part of something called the Voluntary and Community Sector Emergencies Partnership. So this is a range of organisations who come together to improve coordination at national and local levels before, during and after emergencies. And a key part of this is the mental health network. So this is a working group within the partnership, and the focus is on meeting the needs of those who are really likely to struggle with mental health challenges, as we know people do during and after emergencies. So this network helps things like facilitating access to mental health services, raising awareness of gaps, equipping responders with knowledge to signpost, like those mental health pathways I was talking about. So I think we're going to post the link to the mental health network in the chat as well. And I know this is so many resources, so we don't expect you to take it all in, but I'd encourage you to just take a look at this site, because there's loads of resources from a wide range of community organisations available to support you in beginning these conversations. And I'll just particularly note the IFRC has a lovely wellbeing guide available that's on that link. And that's just got some really practical calming and resilience building techniques that you would learn in 10 seconds to learn it. And then you can use that as a resource and take that into your communities and use it with other people.
Thank you so much, Beth. And I for me, there's with our forum, an event today is called Starting the Conversation. But we see it's when we start the conversation, we need to be able to keep the door open and sustain it in the long run with all of the follow-up activities and support provided to individuals, but also to the ones doing and delivering the support. And thank you so much for sharing. And indeed, there are very many resources, and I think it's now the responsibility becoming more and more to be able to absorb them and use them and apply them to their life. Gracie, I'm passing the floor to you for the final wrap up. We have heard so much inspiring and energetic thoughts, and I think also the theme one is working together. It's not a siloed activity anymore. It cannot be to be successful. So over to you, Gracie, for the summary.
Jana. It's true, like the time is against us, but let's now invite to all the panelists to open their cameras. We are going to invite them to deliver 1 minute message that is a call for action and change the conversation. Let's start with Professor Rory, then Dr. Lazari, after Lucia, at the end, Beth. Okay, over to you. It's your time.
Thank you. I suppose my sort of parting message or call to action is human connection saves lives. And we can convey human connection in very simple ways by reaching out, being compassionate, validating how somebody's feeling. And by validation, we simply mean recognizing and acknowledging that somebody else is experiencing distress and saying that must be really difficult for you. So for me, my message is, if you're concerned about anyone, always ask them directly whether they're suicidal. It will not plant the idea in their head. It could get them help and support that they need and genuinely be life-saving.
Thank you, Professor Rory. Dr. Lazari, it's your time.
Yes, thank you. I mentioned at the beginning of today that the numbers of suicide have gone down. And while I mentioned that there is no time for complacency, so this is not a reason to celebrate, but it's a reason to acknowledge that the strategies work, that there are solutions. So there is no time for us to get desperate and to get involved into the sadness and bereavement and grieving of the lives lost, rather than get encouraged by what works and escalate that more and more in our communities, not only at the national level, at the local levels, at the community level, at the family level. So we know strategies work. Let us embrace those, let us disseminate those, and let us do all together our little piece of work for the for preventing suicide and saving lives.
Thank you, Dr. Lazari. Now, please, Lucia.
Yeah, from the RCRC European and Central Asia Youth Network, we will call for action for national societies to implement the Youth Mental Health Manifesto. First, to break the stigma, to invest in projects, activities, and measures, to do so and allow an open conversation internally with volunteers, but also externally to happen. Second, a wider approach to solving mental health problems, including the specific case of youth and children, focusing also on activities that are recreational activities that are targeting the problem, but are also targeting a new issue that we are seeing, that is non-desired loneliness. And lastly, leveraging the value of youth-led programs into young people, so that we know that there is an added value there if it's young people to young people talking about the conversation.
Thank you, Lucia. Over to you, Beth.
Thank you. I'm going to start my call to action with a quote that many of you may have heard before that I really like. Most people do not listen with the intent to understand, they listen with the intent to reply. So my challenge to you, my call to action in having conversations about mental health is to start with today. So choose just one person that you encounter in the rest of your day. And when you come to that inevitable, how are you, that rolls off all of our tongues so easily, so naturally, why not take a moment to ask how they actually are in an intentional way? Try not to rush on to the next task or topic or conversation as we normally would, but let that one person that you've chosen know that you have time for them and want to hear their honest answer, if they would like. And maybe consider sharing honestly yourself if you're struggling, because being vulnerable, as we know about our own challenges, can be really powerful in encouraging others to do the same. I am so aware, me included, we all have such busy lives with endless work and competing demands. So of course, I understand we can't do this for every single person we encounter, but we can definitely do it for one, and maybe that one will do it for someone else, and so on and so on. So my challenge, my call to action for you is to find that one person today and ask with the intention of truly listening, and listen with the intention of truly understanding.
Thank you, all of you, for this strong advice and call. And we hope that all of the 86 persons that are joining this webinar can replicate and take every single word that you say here and replicate it, because you say we need to be human beings. We need to address this on that perspective. We need to join as a community the issue as well. We need to be more aware of the manifesto of the youth, as Lucia mentioned. And one key word here is loneliness, that this is interesting, and maybe we can have another space to speak more with the youth about this no decided loneliness. And as Beth say, it's now. You can start now and don't wait, and select people and support people right now. I'm gonna call to Ghana to give also a last message from the PS Center, and then we're gonna have some announcements. Thank you.
I don't think I have a lot to add to this powerful words of the speakers, and I think what is inspiring and amazing to see that all of the messages are basically aligned. So this key working together is there already, And when it comes to safety planning, and I also want to connect it to what you just said, there's, although the messages can be broad and on a higher level, we can take something and make it actionable on individual for ourselves. So simple safety planning, knowing the plans, knowing how to speak about it, and being open and feeling confident to ask the question and follow up. Look proactively for the resources that are out there, and understanding what can everyone of us do in their role as a professional, and but also as individual. So it's in general being ready to face this situations, because they can happen, and everyone can play a role. But yes, I think the most important one for me is this human connection. It's human to human. This is what we have always with us: compassionate, kind, and non-judgment. And so let's from PS Center side, I can mention that there will be a project on compiling the resources and working on suicide prevention, and integrating that in the psychosocial activity on the community level that that has been launched just recently. So we will be in touch more actively with many of you present here to unite efforts once again to produce even more support and technical guidance how to. Thank you.
Thank you, Gana. So this webinar is coming to the end. We know that is some questions in the chat box, and thank you for sharing your email. We're gonna try to back to you with some suggestions, some advice, and share some resources that you can navigate on and try to find your answers, because this is many resources there, and depending on the case, it's many perspectives that you can address the situation. It's not so easy to answer in a forum like this a question, because we need to see from different perspectives. As well, look, save the date, 24th of October. We are gonna have a second webinar in the frame of the World Mental Health Day. We are gonna count again with WHO there, with UNICEF and national societies. We hope to see you there. We are gonna share details sooner for different channels with the national societies and externally. And we hope that you join and you spread today the message that you received here. It was my pleasure. We are at your disposal 24 hours. If you need it, here in the regional office. Let's get in touch, and remember that mental health matters, okay? So any last comment, Gana, from your side? And we are closing this event.
Just, I think it would be great to mention how we can follow up with that. So there will be a recording, and we compiled all of the resources shared in the chat and disseminated to the participants and to those registered and interested in the topic, right?
Yeah, like you say, we are gonna share it with the national societies, the recording, and it's important to keep these conversations open across the year. Thank you so much.
Thank you so much for spending this hour with us. Thank you, Gracie.
Thank you.
Thank you, Gurzira. And thank you to all of the speakers as well.
And the interpreter, to Irina. Thank you. Yeah.
Thank you so much. Have a great day. Bye.